Hey guys, welcome back to Whiteboard Wednesday. It's Dr. Edwards at Sarasota Vascular. Today we're going to talk about the great debate in vascular surgery, open versus endovascular surgery. Open surgery is what we think of as traditional surgery. We make an incision somewhere in the body. Through that incision, we go down and target a specific part of the body. In our case, it's blood vessels, so that might mean an incision in the neck to get to the carotid artery, an incision in the belly to get to the aorta, in the leg, etc. Open surgery sometimes is required for complex vascular conditions. We have to remove a plaque. We have to replace a vessel that has become an aneurysm. We have to replace that with a graft to restore it back to normal size. We have to sew a bypass, sometimes using a vein to essentially turn it into an artery to restore blood flow to a part of the body that no longer has blood flow necessary to survive. Open vascular surgery is something that enables us to do amazing things, but open vascular surgical techniques have been around for more than 60, 70 years at this point. And in that time frame, while we have honed our skills at to treat these complex problems, technology has created this paradigm shift in how we treat a lot of vascular conditions. That's where endovascular surgery comes into play. This includes things like balloon angioplasty, stenting, sometimes using lasers to clear a vessel, sometimes using lasers to close down an abnormal vein. What we can do with endovascular surgery now is amazing. So consider this scenario. So let's say you have an aortic aneurysm and maybe open surgery is not a good idea for you. Maybe you have some other health conditions and anesthesia would be risky or for any number of reasons. And so the way we're going to fix that is with a stent. Sometimes aneurysms fall down below the arteries to the kidneys, called the renal arteries, and we can place a stent here, okay, to cover up that aneurysm. Well, sometimes the aneurysm is so close to the renal arteries that we can't treat it without treating the renal arteries as well. So we can actually place a stent that either has branches or a stent that is custom made to your very own anatomy that allows us to completely reconstruct the aorta from the inside. We are actually at the point now where we can almost reconstruct the entire aorta through punctures in the arms and through the groins without making big incisions. Of course, there's a role for both, and that's why it's important to involve a vascular surgeon in your care when you're dealing with these complex vascular conditions, because purely traditional open surgical approaches may not be the best answer. And conversely, a purely minimally invasive endovascular approach may not be the best answer. And so that's where we have the luxury of combining the two, which is what we call hybrid surgery. A good example of that would be a carotid stent procedure called a TCAR. A TCAR is an example of a hybrid operation where we make a small incision at the base of the neck. Through that, we place a carotid stent. But by placing a carotid stent in this way, it allows us to reduce the risk of complications during the surgery by 3 to 4-fold. In summary, as vascular surgeons, we like to think that we are able to treat all of the blood vessels in the body. Mind you, we don't go in the brain and we don't do the heart with any type of open or endovascular surgery so that we can tailor that procedure to every specific patient. Thanks for tuning in. Dr. Edwards again at Sarasota Vascular.